Good afternoon. Thank you for listening again today. As we continue to address the COVID-19 crisis in Missouri, it is important for our citizens to stay updated on the facts. As of 2:30 p.m. today, there have been 502 positive cases of the COVID-19 in Missouri. A large number of these cases have been in the age bracket of 20 to 29-year-olds. This shows that it doesn't matter how old you are, you're still at risk, and we need everyone to take this seriously. These are tough times for our state, but we will get through this together. There are still good things happening all around us. Missourians from across the state have stepped up to help from the private sector to everyday citizens. As Director Karsten said yesterday, Missouri's public safety team remains strong and is working each day to get millions of dollars worth of PPE to our hospitals and our first responders. As we continue to address COVID-19, the transportation of PPE is critical. Motor carriers must be able to deliver essential supplies and equipment to our communities as quickly as possible. Several commercial driving regulations have been waived or relaxed, and the Missouri Department of Transportation has been a huge help in this. Our trucking industry has also stepped up to the challenges, and I want to thank all of the men and women working so hard to keep the supply chain open and the goods and services moving to our citizens. Today, Director Patrick McKenna is here with us from MoDOT to give us an update on the MoDOT issues surrounding the state. Director?
Thank you, Governor Parson. Under your leadership, we have been working diligently with our steadfast federal partners and modal agencies of the U.S. Department of Transportation, as well as partners in the motor carrier and agricultural industries to enable emergency flow of goods. We've relaxed the hours of operation for motor carriers to give them more flexibility for transporting goods. We've eased restrictions to allow for heavier than normal truckloads of emergency supplies and equipment to travel on all Missouri highways, including interstates. This includes shipments of livestock and poultry and associated feed and fuel. And we've suspended all Missouri International Registration Plan and International Fuel Tax Agreement trip and fuel permit requirements, including fees for vehicles not currently registered for interstate travel in Missouri. In addition, the Missouri Department of Revenue has implemented a 60-day extension of driving privileges. This extension applies to individuals with commercial drivers or non-commercial drivers license expiration dates of March 1, 2020 through April 30, 2020. For example, an individual with a CDL expiring March 1, 2020 will have until May 1, 2020 to complete the required license renewal in their local license office. Second, the Revenue Department has implemented an extension of CDL medical certificates. This extension applies to individuals holding a CDL or a commercial learner's permit with a current medical certificate that has been issued for a period of 90 days or more and has an expiration date of March 1, 2020 through April 30, 2020. These individuals have been granted an extension of their medical certification until June 30, 2020. This relief will give Missouri's commercial drivers additional time to complete the required medical exam and to submit an updated medical certificate to their local license office so that their Missouri driver record can be updated. Another effort we're making is to keep interstate highway rest areas open to the traveling public and commercial motor carriers. We're also cleaning and disinfecting the rest areas on a more frequent basis. Switching gears a bit, let me outline what we're doing to keep vital transportation projects and essential state highway maintenance operations moving. At this time, we're continuing the design and construction of the state's road and bridge projects. In addition, we intend to proceed with future project bid openings, which are fully electronic, and the Missouri Highways and Transportation Commission will continue to meet monthly by video or teleconference, starting with the April 1st meeting next week. That means that vital projects made possible by the governor's focus on bridge program will continue, as will the construction projects in our 5-year transportation program for now, as we continue to work with industry through their workforce and supply chain availability. The general revenue funded cost share program project contracts for construction will not begin prior to July 1 to help with the closeout of the state's fiscal year 2020 budget. We've been in close contact with our contracting and consulting partners to assure them that payments to them will not be affected and that we'll work with them on specific issues such as workforce availability to ensure projects continue to move forward. In addition, our statewide highway maintenance operations such as pothole patching, striping, and pavement repair also continue at present, although under the guidelines issued by the Department of Health and Senior Services and the CDC for social distancing, hand washing, and so forth. We're also we're keeping lines of communication open with the public through our website and our customer service centers. The public can still call our toll-free number, 1-888-275-6636, 24/7 to speak with a customer service representative or to get the latest road conditions or register a road concern. We're proud to be able to help and will continue to look for ways we can ease the challenges facing our transportation partners at this critical time. Please remember, if you're traveling, observe speed limits, do not drive impaired, and always buckle up and put your phone down. Thank you.
Director, thank you very much. I might just want to add to Director McKenna's statement that he made there, how important it is that I've emphasized to him to make sure these trucks and this transportation for this product throughout Missouri has got to be able to run. And to the point where I know he's went somewhat toe-to-toe with the federal government on how we're going to make sure these restrictions are lifted where we can get product up and down the road. And I want to thank him for doing that, because his orders as a director is make sure we get supplies up and down this road, whatever it takes for the people of this state. So I want to thank you, Patrick, and thank you, Director, for what you're doing. We realize this is a challenging, uncertain time for Missouri and the nation. No matter how you have been affected by COVID-19, whether you or your family member has gotten COVID-19, whether you've lost a loved one or you've lost a job, this crisis is affecting everyone. Mental health is something everyone should focus on, not just right now, but going forward as Missourians continue to cope with the after effects of COVID-19. We're going to get through this together. We have to personally take care of ourselves mentally and physically. Like all of our state departments, the Missouri Department of Mental Health has been taking steps to help with our COVID-19 response. Today, Director Mark Stringer is here today to provide an update from the Department of Mental Health. Director?
First of all, on behalf of the Department of Mental Health, I want to express my sincere sympathy to the Missouri families that have lost loved ones to this virus. Please know that you're in our thoughts and prayers. Second, I want to thank the dedicated men and women who work in our state psychiatric hospitals, habilitation centers, state-operated programs, and contracted community providers of treatment, prevention, recovery, and habilitation services. I cannot tell you how much I appreciate your commitment to serving some of the state's most vulnerable citizens, especially during a time of crisis. The Department of Mental Health serves people of all ages with its mental health services, substance use disorder services, and habilitation services. We serve about 170,000 people a year in a variety of settings that I just mentioned, which includes both institutions and community programs. In response to COVID-19 and under the leadership of Governor Parson, my department has taken a number of steps to ensure that our services continue with as little disruption as possible. For example, working with Director Todd Richardson and his great team at the Mo Health Net Division, we have relaxed or suspended some of our rules and regulations that would prevent our community providers from delivering essential services during this time. We've also made it possible for community providers to do much of their work by telephone rather than the traditional face-to-face requirement. Our service providers have dramatically ramped up their use of telehealth and telephones, and we are exploring ways to stay in touch with people who cannot afford cell phones or extra minutes. For our psychiatric hospitals and HAB centers, we've worked with other state departments like corrections, social services, and public safety to share policies and procedures that are best practices in both natural and man-made disasters. Sincere thanks to my colleagues, Director Precythe, Director Tidball, and Director Karsten. Where possible, our state employees and contracted providers are working from home in order to minimize the risk of infection. But in many cases, in our hospitals and HAB centers, for example, it's simply not possible. Again, the bravery and dedication of those professionals is truly remarkable. Finally, for the mental health of all Missourians who may be struggling to cope with this pandemic, here is an important resource. The Federal Disaster Distress Helpline was created for times like this. It is staffed with mental health professionals who can talk with you, and if you need more help than they can provide, they can connect you with services here in Missouri. Specifically, they can connect you with our Access Crisis Intervention System, or ACI. It's staffed with professionals linked to state-certified mental health and substance use disorder services. They are there to help you, and the ACI system is free and completely confidential. So the Disaster Distress Helpline has a website which is easily found with a search engine like Google, or you can call 800-985-5990. Again, that number is 800-985-5990. Thank you.
Thank you, Mark. One thing I just want to mention, every day these department officials that are in here speaking to you is talking about things they're doing to help the everyday people out there, whether it has to do with daycare, whether it has to do with transportation, whether it has to do with mental health, from all aspects of government. What we're doing every day is basically, as of today, we've deregulated over 158 regulation, rules, and laws to make sure we're providing a service to the people of this state without the normal procedures of delay or going through the bureaucracy, and we will continue to do that. And you see this every day in our society of what we're doing to try to make things better from the governor's office and trying to make sure that all these department heads are working hard every day to make sure that we're making it as easy as we can and taking care of the people of this state. So with that, Kelly, we got some questions today.
We do. These are from some media inquiries that have given to us. The first one is Jennifer Moore from KSMU Ozark Public Radio. She asked, currently it is DHSS protocol that even in nursing homes and assisted living facilities where there is an outbreak of COVID-19, only those residents with symptoms are able to be tested. DHSS has confirmed this is due to a scarce amount of testing. My question to Governor Parson is, given the way the coronavirus spreads through nursing homes in Washington state, would you be willing to change that protocol so that every single resident in the coronavirus confirmed long-term care facility can get a priority test?
I would be willing to change that if it was possible to do. But I know every day there's a shortage of the test kits that are out there, and we have to allocate which ones we think are a priority for our state. As much as I would help everyone that could be able to be tested today that wants to be tested, the reality of it is we don't have the test. They don't have it nationally. So we have to prioritize who we're going to test and who we're not. Unfortunately, we have to make decisions that the medical personnel has to make decisions on that. I got to trust that medical staff, those doctors, to do that job every day. But I also have to be able to test those frontline people, whether it's the doctors, whether it's the nurses, whether it's people in the emergency room that actually are dealing with us on a daily basis. And it's unfortunate, but every day that gets to be a little bit better, but it continues to be a problem nationwide, not just here in Missouri.
Okay, this question is also for you, Governor Parson. This one is from Sebastian Martinez Valadivia from KBI Columbia. Is the governor designating specific resources for rural areas that lack ICU beds?
Today, as we speak, when it comes to the bed space in the state of Missouri, we have a plan in place. Director Richardson is working on that for us. They were out at SEMA this morning, the staff was, working with the Corps of Engineers, working with the National Guard, with a lot of different people. But we're finding sites all over the state of Missouri that we can convert into medical facilities or hospital beds, whether in rural Missouri or urban Missouri. Again, with the data you see every day here at the governor's office, you have to allocate your resources where they best fit for that time and where we know those severe problems are. So every day we make plans for that. We always take in, whether it's urban or whether it's rural, to have a plan in place for the next few days or for the next months. But we're planning that every day here at the governor's office.
All right, this one is for you also, Governor Parson. Jack Suntrup from the St. Louis Post-Dispatch. There seems to be a large demand for a statewide stay-at-home order. Today, have you changed your mind on that?
You know, I have not. I answered that question yesterday, but I think it's important. We look at that every day. We look at it from a factual basis, statistic-wise, where these cases are, and at what point we would make that decision if we did. But, you know, every day I got to keep in mind, I've got to do the whole state. And the other thing I think you keep in mind, the mayors are doing their job out there too. They've already got a lot of orders in the urban areas where it's the most cases are. But again, I've got to evaluate that, whether I shut down the entire state with that order or not. I still think the most important thing you can do, and I think when it really gets down to all the red tape that we go through, it's a matter of staying home if you don't have to be out. No more than groups of 10 and staying 6 feet away, the social distancing. Those are the keys to fight this virus.
Okay, this next question is for Dr. Williams. This is from Jason Hancock, the Kansas City Star. More than half of Missouri positive COVID-19 tests have come from the private lab. Because those labs report only positive tests, the state does not have an accurate count of how many residents have been tested for the virus and what proportion of those tests were positive. So, Dr. Williams, does this cause you concern in the state's ability to track this outbreak? And have there been any steps being taken to change this process?
Again, I'm Randall Williams, Director of Health and Senior Services, and thank you very much for the question. We do track negatives. We changed our regulations so that we know that we've done more than 6,000 tests here in Missouri. Our numbers are reflecting national. Our state lab is about 8% positive. For our commercial, it looks to be about 6 to 8% positive. The good news is that for those 92 to 94 out of 100 people that are testing negative who are symptomatic. When we look at our data reporting compared to other states, I think people have recognized that we try to be incredibly transparent. We put on our website, like other states aren't doing, the location, the age, and we're using that data epidemiologically to try to model where we're seeing clusters. I think the governor started out very correctly saying if you look at our data, it's 20 and 30-year-olds that appear to be people who are testing positive. And so I think our message has been very, very consistent that while they may not have the morbidity, what we're learning is that they certainly may be propelling the infections. And so we just want to reiterate one more time that social distancing, even among 20 and 30-year-olds, is so incredibly important to get it from getting into our nursing homes. We'll, just address that real quickly, is that I just got off the phone with a clinician. Our new guidelines on Monday are designed to give clinicians more discretion, and they very much have appreciated that in talking with them since then. So that at any time, what we've tried to do is to loosen our criteria so if there is a situation like that, that they have the discretion to do the test. The incubation period, again, is 5 days, and people are most symptomatic when they're infectious. So when they're coughing at 5 days is when those tests are most likely to be positive. But again, we're happy to share any of that data with you. We think that, as the governor has said, that we understand people are very anxious, and we think one great way to help people is to give them as much information as we possibly can. Thank you.
Thank you, Dr. Williams. Earlier today, I spoke with the White House, with the President and the Vice President and other governors around the state of Missouri. And going back to the question it was just asked, every governor in the United States is struggling to get this equipment. You've got the industrial might of the United States on 24 hours, 7 days a week trying to provide these products. And every day this is an issue with all of us. We're all trying to figure out how we can get more of those supplies. And again, I want to stress what I said yesterday. There's so many people in the state of Missouri that's stepping up, that they are literally stepping up, trying to figure out how they can help, whether they can make the PPE, the garments for emergency personnel, whether we can make the masks, whether we can figure out other alternatives to testing. Everybody's trying that every day across the United States. And right now, the reality of it is some of these areas like New York is getting a lot of supply and a lot of resources going their way, and understandably so. But it's still frustrating when you're the governor of the state of Missouri and you're fighting that battle every day. But we're going to continue to fight for the people of this state. but it is going to be an ongoing battle in the days to come. So let me just say this every day, and I'm going to continue to say it every time I get up here in front of the Missourians. Social distancing is the most important step you can take to stop the spread of COVID-19. Whether you live in an urban area or a rural area, stay home as much as possible. This is just not about you. This is about everyone around you and the entire state of Missouri. We will continue to overcome this, but it's going to take all Missourians working together, looking out for each other, and following social distance orders. It is the most important thing we can do, is to stay at home when you can stay at home, enforce the social distancing rules on yourself. Don't wait for government to do it. You take it upon yourself as citizens of this state. If we will do that, and we'll make sure our families do that, and our friends do that, and the people that were in our communities will do that, we will get ahead of this virus. But it's going to take a while, but we have to start now, abiding by these rules and orders. Thank you very much for today. Thank you.